So our group presentation is on tuberculosis, and tuberculosis is a bacterial infection. So my group is Taisha, Diana, Isaac, Talia, Melissa, and me. I'm gonna skip this slide because my group already has covered it in all of their portions. And the most common symptom or sign of TB is coughing that lasts 3 weeks or more. And it can include coughing up blood or phlegm. And it also is accompanied by chest pain and weight loss, fever, fatigue, night sweats, chills, and loss of appetite. And now most schools, well, I know LAUSD, before the child is admitted into preschool, they need to show their vaccinations to see if the child has had their TB vaccine. There are different types of TB, and this is the different types and the symptoms that accompany. So there's pulmonary TB, which is TB in the lungs, and that's the most common form of TB, and it's accompanied with a cough that lasts 3 weeks or longer, and you can cough up blood or phlegm. Extrapulmonary TB, it just means that it's TB outside of the lungs, so this can include any TB in your body. It's just called extrapulmonary because it's outside of the lungs. And some symptoms, and there are no signs of where the infection is in the body. Lymph node TB is the inflammation and enlargement of lymphs, and the inflammation or enlargement of lymphs is a common side effect. Lymph nodes. Of the lymph nodes, it's a common side effect for kids. It can be for any infectious disease, their lymph nodes will be inflamed, so it's hard to detect that it's actually TB. And TB lymphadenitis has no other symptoms. The lymph nodes affected are the neck lymph nodes or the groin, near the groin. And there's also skeletal and joint TB, and these symptoms include joint pain or weakness of the bone, so you can get easy fractures and breaks, and also like deformation of the bone. There's also TB meningitis, and it doesn't include the normal symptoms of meningitis. It usually starts with 2 to 8 weeks of just body pains and fatigue, and then later on you get the symptoms of vomiting, headache, neck stiffness, and sometimes it can even cause seizures.
But what's happening? What is actual target?
Meningitis, it's
meningitis. What is inflamed? The infect of which tissue?
The meninges, yeah.
The meninges, what? The membrane that's surrounding the central nervous system, brain and spinal cord.
Yeah. And so types of TB continued. There's also gastrointestinal or abdominal TB, and that it's accompanied with abdominal pain, diarrhea, or bleeding from the rectum or anus. And TB in children is usually pulmonary TB, and the symptoms usually are chronic coughing, fever, and weight loss. And extrapulmonary TB occurs often in children under 3 years of age. So it's children who are under 3 years old that usually get TB that's not in their lungs. Etiology of tuberculosis. Tuberculosis is caused by the infectious agent known as Mycobacterium tuberculosis. Mycobacterium. Mycobacterium tuberculosis, and it's a rod-shaped bacterium. It's also called Koch's bacillus. And the Mycobacterium tuberculosis is a small, slow-growing bacterium that can only live in people. It is not found in other animals, insects, soil, or non-living organisms. Mycobacterium tuberculosis is an anaerobic bacterium, and that means it needs oxygen to survive. During active TB, anaerobic.
It needs oxygen. Anaerobic.
Oh, it doesn't need oxygen. It does. Anaerobic.
Anaerobic. Okay.
Yeah, anaerobic. So it means it does need oxygen to survive. And Mycobacterium tuberculosis complexes are always found in the upper air sacs of the lungs. So if there is tuberculosis found in the lungs, it's usually in the upper portion of the lungs.
Your critical thinking, why it's in an upper portion?
Because of the bronchial? No?
Why do you think it's on the top of the lung? Because the top actually slightly come out over clavicle.
Clavicle.
Yeah. Because it's inside us, right? So why is here not there? Pressure.
It's not protected by bones. I don't know.
Yeah, it's not that it's kind of the bones.
Yeah.
Because it's less ventilated.
Oh.
Less ventilated. Because your bronchial tree going down. Okay, this is less ventilated area.
When a person breathes in Mycobacterium contaminated air, the inhaled TB bacteria reaches the lungs, and this causes Mycobacterium tuberculosis infection. So not everyone infected with TB bacteria can remain dormant for years and not cause any TB disease. So that means you can have the TB bacteria in your body, but it won't be active. You won't see the symptoms. Dormant, yeah. This is called latent TB infection.
Like latent, like a criminal that's hiding, escaping. This is where it's coming from, the name, latent.
And people who have latent TB infection do not get sick or do not show symptoms and do not pass the bacteria to other people. And some people with latent TB infection eventually do not even get the TB disease. They're carriers, exactly. And for someone to develop active TB disease, the following two events must take place. The bacteria must enter the body and cause Mycobacterium tuberculosis infection, and the immune system will not be able to stop the TB from growing and spreading after the initial infection. So if you have a weak immune system, you can definitely get the TB disease. And the active bacterium multiply and destroy the tissue that it's affected. And a person with TB disease shows symptoms that vary depending where the TB bacteria is growing. Like I discussed, there's different places that you can get the TB disease. And so these are pictures on the right. That's what the TB bacteria looks like. It's a rod-like shape. And tuberculosis in the lungs. A person may contract pulmonary tuberculosis from inhaling droplets from a cough or sneeze by an infected person. So this virus is airborne. So the morphology of the bacteria, it has a tough cell wall that prevents passage of nutrients into and out of the cell, and therefore giving it the characteristic of a slow growth rate. The cell wall of the pathogen looks like a gram-positive cell wall. And the cell envelope contains a polypeptide layer, which is a chain of amino acids, and a peptidoglycan layer, which is sugars and amino acids, creating a mesh-like layer, and free lipids inside of it. Also a complex structure of fatty acids such as mycolic acids that appear glossy, and the cell wall contains 3 classes of myoclaxids, which is alpha, keto, and methoxymycolates.
Okay, this is okay. There's a biochemistry,
Yeah.
but who went through the cell metabolism? Can we call that when we were talking about membrane, we were talking about particular molecules that are completing this, right? It was a fat, it was lipids, and phosphate. Phosphate with introduction of proteins as well as the channels. So this is description that's slightly different. We see also what glucose molecules as well, right?
Yeah.
Proteins. It's only description because this is another cell that will have this reinforcing cell wall, right?
Yeah. And there are parenchyma. So beneath the cell wall, there are layers of galactose and a monosaccharide containing 5 carbon atoms, and the peptidoglycan that lie just above the plasma membrane. On the second bullet point, and peptidoglycan, which is amino acids and
Peptidoglycan.
Yeah, it's amino acids and sugars that create a mesh-like.
Yes. Amino acids is the protein. So
Yeah.
It's a particular glycoprotein.
Okay. So the prognosis of this disease is that it's usually found in the lungs. There are extrapulmonary cases where the bacilli infect other parts of the body, usually the lymph nodes, bones, central nervous system, which was the meningitis we were talking about, and cardiovascular and gastrointestinal systems. Major symptoms of TB are prolonged cough, bloody expectorations, chest pains, and changes in a person's general health status. So that can include weight loss and loss of appetite. Coughing, sneezing, talking, and spitting can all spread the bacilli into the air, where they can remain viable for several hours before another person can get the virus. So outside of your body, you can, if you cough or sneeze on something, the bacteria will stay on that surface for a prolonged period of time. It doesn't just die because it's a spore, yeah. Mm-hmm. And so the treatment includes isorizid and rifampid, and those are the most popular forms of curing TB. Tuberculosis can take much longer treatment than any other type of bacterial infection, and you can take antibiotics for at least 6 to 9 months. So that is a very long period of time to kill the bacteria. And the exact drug and length of treatment depends on your age and the form of TB, whether it's lateral or active. Latent, yeah. It's the wrong word. Latent or active, and the infection location in the body. So it just depends what type of TB you have. So this is an example of what the TB in the upper portion of your lung and how it'll deteriorate your lung. And these are just symptoms. And
I remind you guys that we're talking about feverish. It is never high fever. It is feverish. Okay, usually pulmonary infection would be related to the feverish. It is not high numbers like that. One of three or something like that. And usually it is always accompanied with sweat, particularly night sweat, as Laura was mentioning. So pay attention to the symptoms and check immediately with your physician.
Prevention of TB. Treatment to prevent active TB from developing in a person with a late tuberculosis infection aims to kill walked up germs that are doing no damage right now but could break out years from now. So this is the latent TB. And treatment also can stop the spread of TB in large populations. And the TB prevention consists of two main parts. The first part of TB prevention is to stop the transmission of TB from one adult to another. And this is done through firstly identifying people with active TB and then curing them through the provision of drug treatment. And with proper TB treatment, someone with the disease will very quickly not be infectious, right? I can't read it because it's really small on my screen.
So it can go
in
this function. Okay.
Okay. Yes. With proper TB treatment, someone with active TB disease will very quickly not be infectious and so can no longer spread the disease to others. And the second main part of TB prevention is to prevent people with lateral TB from developing the active form and the infectious form of the disease. There is a vaccine for TB, but it contributes a small portion to the prevention of TB, and it does little to interrupt the transmission of TB among adults. The vaccine is called Bacillus calmette-guerin, so BCG, and we've all basically have had the vaccine for TB, but you can still get it from an adult or someone who actually has the TB bacteria. And the drug treatment for the prevention of TB can reduce the risk of a first episode of active TB occurring in people either exposed to the infection or with latent TB. It can also reduce the risk of a recurrent TB episode. The drug-resistant TB is the TB bacteria that becomes resistant to drugs that are used to treat TB. And this means that the drug does not kill the bacteria that's present. And when people do not complete full course of treatment when they are diagnosed with TB, can build drug-resistant TB. And when this can also occur if healthcare providers prescribe the wrong drug or the wrong dose, because as I said, TB can be all over the body, and the healthcare provider should make sure that they're prescribing you the right form of drug. And drug-resistant TB develops when proper treatment is not met. So it can be bad, like if you didn't finish your dose or any of these things that I mentioned. And also if they have been treated for TB already and the infection returns, there's a chance that it will be a drug-resistant TB because the bacteria is now stronger and familiar to the medicine that was used. And if you have traveled to areas of the world where drug-resistant TB is common, so if you travel somewhere and in that area they have TB that is drug-resistant and you get TB, the chances are that it'll be drug-resistant TB. And drug-resistant TB is when the organism is resistant to isomias, and rifampin, the two most potent TB drugs. So those are the two most used to cure TB. Rifampin, isomizid.
This is antibiotics.
Yeah.
And last is what?
The last is TB in the surgical field. So to
TB or we're talking about patient.
Patient. Patient with TB. Yeah. So if you are dealing with a patient with TB, the prevention of transmission is decreased if you use gloves and respirators. And what was that?
Which glove? We're always using gloves in the surgery.
Yeah. I didn't look that up. So it's a special kind of gloves, okay? Make sure you wear these special. It's not? Double glove? No? We always double glove.
It's in the surgery, you have to include that double glove. In the transportation of the transportation of the isolated patient, right? We're talking about isolation patient because it's a highly contagious or disease. So apart that you will educate the patient to wearing masks. Okay, and also educate the non-speak, whatever. Just limited contact as well. His or her chart can be placed in a bag. Okay?
I've touched
You
it.
touch it only with gloves. Okay, you're transporting your patient. If you're assisting in the transportation of this patient, the surgery is only always the gloves, gown, and you're wearing mask.
Yeah.
Okay, so this is what that's what about. For us in a surgery, when already we're performing surgery, that most likely this is surgery, if it's emergency, it's kind of hard even to define. Maybe patient infectious, maybe not, right? So in elective surgery, yes, doctor will contact physician and that has in here this patient, and we will confirm that this TB. But in any way, fashion, what each patient is treated as infectious. Okay,
Yeah.
so it will be, and it's the same thing. Environmental service crew will clean up in the same way fashion as we're doing all the time.
Yeah.
Okay.
So I guess if it's known that the patient has TB,
so
then they will do special.
For to the patient. So we asking wearing a mask because usually what You're wearing a mask? Not really.
No.
Right? So when you're transporting in this way, yes, will be given extra precaution. Any questions, guys? No? Everything straightforward?